Overall, the health of Alaskans and their access to health care compares to that of the rest of the nation. Unfortunately, not all Alaskans share the same access to health care, nor are they as healthy as others. In fact, Alaska suffers from some of the worst health disparities in the nation, with Alaska natives suffering disproportionately. What are healthcare disparities? The word disparity can be defined as the condition or fact of being unequal. Synonyms for disparity include inequality, unlikeness, and difference. Healthcare disparities can be delineated by describing differences in the quality of and access to healthcare. Many Alaskan natives, by virtue of their geographical locations of their communities, do indeed suffer from lack of access to healthcare. Many Alaskan Native communities are far removed from urban centers where high quality health care is available. Many of these communities are not connected to the Alaska road systems. Weather in Alaska is also notoriously unpredictable, and conditions to travel safely are not always present. This makes travel for a large number of Alaskan natives expensive and difficult at best. This difficulty associated with access to health care creates a disproportion in the quality of the care they do receive. There are other reasons Alaskan natives suffer from disparities in health. The geographical locations of many Alaskan Native communities does more than just create obstacles to obtaining non-fragmented quality health care for the Alaskan natives who live there. By virtue of the drastic climate changes that are occurring, especially in the polar regions, threatening food sources and cultural and social identity, Alaskan natives' health disparity gap is growing even wider. Alaskan natives are feeling the effects of dislocation from their subsistence lands and also traditional food shortages that can be attributed to climate change. Among North American indigenous peoples, the Native Americans who continue to practice traditional and subsistence lifestyles to perhaps the highest degree are those in Alaska, where 80% of the diet comes from immediate surroundings. Numerous climate-related factors may be working together to change erosion patterns. Some coastal villages have been swamped, and substantial shifts are occurring in plant and animal populations as they try to adapt to the thawing tundra. Polar seas are warming, sea ice shrinking, and permafrost is thawing. This trend, impacting subsistence lands and the lifestyles, not only influences the amount and types of foods Alaskan natives consume, which can affect their physical health, but the lack of traditional ways of knowing and decreased subsistence activities can have a negative impact on Alaskan natives' mental health as well. Changes in Alaska's ecosystems caused by pollution, contaminants, and global climate change are negatively impacting Alaskan natives and rural residents who rely on natural resources for food, culture, and community identity. While in the past, Alaskan natives have relied on Alaska's land, water, and animals for survival and cultural identity, today, because of distrust over possible resource contamination, Alaskan natives may be avoiding these wild resources. This decline in subsistence foods are forcing Alaskan natives to consume more store-bought foods, which tend to be less nutritious and more expensive to procure than traditional foods. This change in diet and activity may be contributing to a decline in traditional activities and a decline in general health. It is important to know that food serves as an important vehicle in the production of meaning and identity. In addition, subsistence activities are integral to the life of families and communities, an aspect of their identity and continuity expressed in subsistence work. This loss of identity, brought about by decrease in traditional environmental knowledge and subsistence activities, in addition to a reduction of the consumption of traditional native foods, can have a negative impact on the mental and physical health of individual Alaskan natives, and can further have a bearing on the health and well-being of their entire community. These losses only add to the widening fissure in health disparities Alaskan natives are dealing with. One only has to look at the statistics to see how wide the health disparity gap is for Alaskan natives. Access to health care is an important indicator of health. Access to quality health care is influenced by having a personal health care provider and having health insurance. And having a usual source of care may be the more important of the two. In 2010, 57% of Alaskan natives and 49% of adults living in Alaska's rural regions had a personal health care provider, compared to 70% for both whites and those living in urban areas of the state. Adult general health status is another important indicator of health and well-being. Self-rated health status is a simple measure of health-related quality of life that has also been related to general happiness and life satisfaction. Self-rated health is recognized as an indicator of a population's overall well-being, as lower ratings of subjective health status have consistently been associated with increased mortality, adverse health events, increased healthcare utilization, and illness severity. Unfortunately, a disparity for Alaskan Natives is reflected here also. More non-natives, 64%, than Alaskan Natives, 43%, rate their health as very good or excellent. Ratings of general health status increase with education, income, and whether you reside in a rural or urban environment. The statistics are telling. Those living in rural Alaska are less likely to rate their health as very good or excellent than those in the state's urban populations, 42% compared to 55 to 61%. The CDC reported social statistics for American Indians and Alaskan Natives. In doing so, they revealed even more disparities for Alaskan Natives. The prevalence of not completing high school among adult Alaskan Natives aged 25 and older was second only to Hispanics and similar to African Americans. The percentage of Alaskan Native adults living in poverty was among the largest compared to other populations. The prevalence of unemployment among Alaskan Natives aged 18 to 64 was second only to non-Hispanic blacks and substantially greater than that of non-Hispanic whites. Alaskan Natives had a rate of 15.8% unemployment compared to that of 16.5% for non-Hispanic blacks and only 8.3% for whites, almost double. Alaskan Natives also face disparities when it comes to substance abuse, violent injury, and death. Alaskan Natives have the largest prevalence, frequency, and intensity of binge drinking. Smoking prevalence is highest among Alaskan Native youth and adults. Drug-induced deaths in the 30 to 39-year-old age group for Alaskan Natives was highest among other racial ethnic populations. Deaths from injuries were higher among Alaskan Native people compared to non-Hispanic whites, with accidents and unintentional injuries the third leading killer of Alaskan Natives. Death records show that Alaskan Native death rates for both men and women combined were nearly 50% greater than rates among non-Hispanic whites during the 99 to 2000 statistical range. Also reported is a high prevalence of Alaskan Natives. There's overall homicide rates and suicide rates in adolescents and young adults. Overall, suicide rates were nearly 50% higher for Alaskan Native people compared to non-Hispanic whites and more frequent among Alaskan Native males and persons under age 25. Alaskan Natives had the highest rate of motor vehicle-related deaths, and this death rate was approximately 2 to 5 times higher than other ethnicities and races. Overall, death rates from motor vehicle crashes, poisonings, and falls were 2 times higher for Alaskan Native people than non-Hispanic whites. Low birth weights and infant mortality have strong correlations to the health practices, and well-being of a community. They are important indicators of maternal, nutritional, mental, and physical health, prenatal care, and they correlate with teen pregnancy rates. The disparities that infant Alaskan Natives face is revealing of their community's ill health, and factually quite alarming. In 2013, the CDC reported that American Indian and Alaskan Native births per 1,000 women aged 15 to 44 was 46.4, compared to 12.6 for that of the general population. Alaskan Native and American Indians with low birth weight percentage was 7.5, compared to the general population of 8 and white population 7.0%. American Indian and Alaskan Natives who infant deaths per 1,000 live births was 8.28 compared to the general population of only 6. In addition, death rates, which was birth from birth to 1 year of life, were higher among Alaskan Natives and American Indian infants compared to non-Hispanic white infants. Also, sudden infant death syndrome and unintentional injuries were more common. And Alaskan Native and American Indian infants were 4 times more likely to die from pneumonia and influenza. Maintaining a healthy diet and weight, getting regular exercise, sustaining from tobacco, alcohol, and drugs, seeing a health care provider for screening and proper management of chronic diseases, and routine health visits are all extremely important to maternal and infant health. And not just pregnant Alaskan Natives, but it's also important to all Alaskan Natives. Regrettably, we see health disparities in many of these modifiable health indicators. The percentage of American Indians and Alaskan Natives who smoke is approximately 24%, compared to 18% for the general population. Only 27% of American Indian and Alaskan Native adults are considered of a healthy weight, compared to 36% of whites. Also, 41% of all American Indians and Alaskan Natives are considered obese, compared to 28% for that of whites. In 2014, it was reported that heart disease and lung cancer mortality among American Indian and Alaskan Natives has not changed and is still increasing for American Indian and Alaskan Native females, whereas it has decreased for non-Hispanic whites. Overall, American Indian and Alaskan Natives have almost a 50% higher death rate than non-Hispanic whites, and the leading causes of death are distinctively different, with diabetes, intentional and unintentional injury, and chronic liver disease taking a particularly devastating toll on the American Indian and Alaskan Native peoples. The CDC supports these statistics with their conclusion that patterns of mortality are strongly influenced by the high incidence of diabetes, smoking prevalence, problem drinking, and health-harming social determinants. Although the public health community is generally aware that American Indian and Alaskan Natives do endure substantial health disparities, there are several reasons why these inequalities continue. One of which is that American Indian and Alaskan Natives' health needs are often under-recognized and excluded from discussions on healthcare policy. There is need recognized for the Indian Health Services, or the IHS, to increase healthcare coverage to a greater number of American Indian and Alaskan Natives. The IHS is seriously underfunded and only gives care to roughly a fourth of all eligible to have their health care needs met at IHS facilities. In fact, slightly 1/2 of low-income American Indians and Alaskan Natives with no other form of health insurance even have access to an IHS facility. Although the IHS is charged with serving the health care needs of American Indians and Alaskan Natives, overall, more than a half of them have limited or no access to IHS services. Geographic isolation and economic factors are the factors that contribute to poor health incomes for American Indians and Alaskan Natives, and thus create enormous health disparities and inequalities. There are opportunities to improve upon these injustices. The Institute of Medicine points the way forward in the recommendations that emerge from its assessment of racial and ethnic disparities in healthcare. It is thought that accurate and timely data collection is being critically important in the effort to understand and eliminate these disparities. The Institute of Medicine also stresses the need for further research of American Indian and Alaskan Native health and additional study of health disparities. Strategies that have improved access to health care for other underserved populations also need to be identified and studied. Medicare is one possible mechanism for reaching low-income American Indians and Alaskan Natives. Another is to explore options to improve the efficiencies of the IHS and to possibly expand funding the program. According to the Institute of Medicine, educating the public, health officials will also need to be a priority. Based on a review of literature on health disparities and sound cultural competence, researchers felt that although progresses in economic and social circumstances and the physical environment would contribute to reducing health disparities, health service interventions can also reduce inequalities, and that these interventions need to be conducted in a culturally competent manner. To contemplate this theory, think of the idiom, for a healthcare worker to truly and holistically care for someone, they must truly know the patient's community, and their culture. Efforts are underway that demonstrate renewed attention to the health status of American Indian and Alaskan Natives, and potentially a shift in values as society makes further progress toward health for all. Disparities in health outcomes are not intractable, and an evidence base is emerging for effective interventions. To decrease the health disparities that American Indians and Alaskan Natives face, the IHS has narrowed their focus on novel uses of health information technology and telemedicine, as well as comprehensive locally tailored prevention and disease management programs. It is believed that these advancements may have led to recent achievements, including a reduction in the life expectancy gap between American Indian and Alaskan Natives and whites from 8 years to 5 years, and a markedly improved measures for diabetes control. Regardless, continued innovation and increased funding are required to further improve health and achieve health equality. Local and state efforts are also underway. The Alaska Environmental Public Health Program recognized that Alaska traditional foods are nutritiously valuable, and subsistence food use is also associated with important cultural and economic benefits. They are engaged in work to assess the health benefits and risks of subsistence food consumption and characterize the safety of traditional foods. This program is focusing on the known nutritional, cultural, and economic benefits of subsistence foods. The AHSS also recognizes that there must be a balance between both the benefits of subsistence food gathering and consumption of these foods and the risk posed by such as water, land, and animal contamination, as well as the risk involved with increased consumption of less nutritious store-bought foods. In addition, the Alaska Department of Health and Social Services and the Alaskan Native Tribal Health Consortium have come together to support the development of long-term health goals toward building a healthier Alaska, and that initiative is Healthy Alaskans 2020. This program is promised to identify Alaska-specific leading health indicators to guide efforts in our state around common health objectives. The overall goal is to improve health outcomes and decrease health disparities, and to attain the vision of healthy Alaskans in healthy communities. They encourage communication and dissemination of information, and encourage all stakeholders to collaborate and align their efforts with Healthy Alaskan 2020 health indicators. The state identifies challenges in meeting the Healthy Alaska 2020 targets, indicating a need for more public awareness regarding the benefits of reaching identified targets, identification of sharing of strategies and guidelines known to improve the identified targets, and increased public policy development, stakeholder commitment, and use of available resources to support implementation of these strategies and guidelines. Resources available through the Healthy Alaskans 2020 initiative will include information related to culturally centered, evidence-based strategies to help reach identified targets and an interactive database to track and monitor progress. Improving the well-being of mothers, infants, and children is an important public health goal for the United States. The well-being of mothers, infants, and children determines the health of the next generation and can help predict the future public health challenges for families, communities, and the medical care system. The leading U.S. maternal, infant, and child health leading health indicators are the total of all infant deaths and total of preterm live births. These are also the leading health indicators that our state's Healthy Alaskans 2020 program, which mirrors the National Healthy People 2020 program, will track and work on improving in an attempt to progress our state's health and decrease our health disparities. I have highlighted the health disparities faced by many Alaskan Natives. I will conclude that with key dedicated stakeholders involved, including Alaskan Natives individuals themselves, their communities, and their corporations, along with federal and state policymakers, the public, business, and local communities, and public health professionals who are culturally competent, we can continue dialogue about how best to meet the needs of Alaskan Natives. It will take a great effort from a multidisciplinary team led by individual Alaskan Natives and their communities. The need is great. The effort will need to be strong and sustained. Together, we can assist our Alaskan Native peoples to become healthier and lead long, productive, and happy lives.